Have you ever looked at your child and thought, was that rash there this morning? Or why is there a fever and a weird rash? Panic mode activated, right? Don't worry, you're not alone. Hey there! Welcome back to the channel DocDecoded. Fever with rash can look scary, but today we're decoding what it really means and when you should be concerned. Stick around because by the end of this video, you'll know exactly what to look for, what to do, and when to rush to the doctor. Before we dive in, have you or your child ever had a rash that suddenly showed up with a fever? Tell us your story in the comments. How it looked like. Your experience might help someone else feel a little less alone. Fever with rash, what's the deal? It is surprisingly common. And thankfully, it's often harmless. Most of the time, it's caused by viruses that go away on their own. But sometimes, it can be a sign of something serious that needs quick medical attention. A common test doctors do is to press on the rash to see if it fades. If it doesn't fade, that can be a sign of serious infections, like meningococcal disease, which needs urgent care. Let's break down the common culprits. 1. Viral infections. These are the most common. Measles or rubiola. Fever, followed by a red blotchy rash that starts on the face and spreads. Rubella or German measles. Milder rash and fever usually occurs. Roseola, common in babies and toddlers. Fever for a few days, followed by a rash as the fever comes down. Hand, foot, and mouth disease. Fever with rash on the palms, soles, and inside the mouth. Chickenpox. Fever, followed by itchy blisters all over the body. Herpes. Fever with blisters and vesicle located in one region. Dengue and chikungunya caused by virus, but spread through mosquitoes. Especially in tropical areas, these are common. They can cause fever and rash, and sometimes joint pain, a tropical vacation souvenir no one wants during peak time. 2. Bacterial infections. Less common, but important. Scarlet fever, caused by Streptococcus throat bacteria. It gives a banana paper-like rash, along with fever and sore throat. Typhoid may cause a faint rash called rose spots on the abdomen. 3. Allergic reaction, sometimes a rash with fever, can be due to a drug allergy or a reaction to a new medicine. This needs careful attention. If you notice this, don't ignore it. Call your doctor. Heat rash or prickly heat, seen in hot, humid weather, but usually doesn't cause fever unless there's infection. Flare or acute attack of some autoimmune diseases or drug reactions. Other causes includes the mixed bag. What does your doctor mean by rash? What we commonly call as rash may be different for your doctor. Not all rashes are the same. Here's a crash course in doctor speak. Let's know different appearance, what we call as rash. Macule. These are flat lesion on skin defined by an area of changed color. On pressing it may or may not disappear, like brown spots in old age. Hyperpigmentation due to hormonal changes. Papula raised, solid lesion of diameter less than 12 millimeters. There may be mix of maculopapular eruption, as in chikungunya fever, rat bite fever. Plaques. Bigger flat lesions, like macule with more drama. Scales are lesions more than 5 millimeters, which may get removed by scratch, as in psoriasis. Nodules. Larger, deeper bumps. More than 5 millis in diameter, with a more rounded raised figure found in acne. Larger ones are found in syphilis. Wheals are papules or plaques that are pale pink that usually last only for 24 to 48 hours in any defined area. It is a sign of allergic reaction called urticaria. Vesicles, less than 5 mm, and bullae, more than 5 millimeters, are circumstances, elevated lesions containing fluid as found in chickenpox, herpes, drug reactions, hand, foot and mouth disease, etc. Pustules, like vesicles. These are raised lesions filled with pus. Petechiae and purpura are bleeding lesions of less than 3 mm, whereas if more than 3 mm, it is called ecchymosis. Petechial rash are found in viral hemorrhagic conditions where there can be internal bleeding, as in case of dengue, leukemia, platelet defects, liver diseases, etc., etc. Ulcer. It is a defect and discontinuation of skin going into deep eschar. Dead tissue covered in black crust. Sounds like a villain, but very real in some infection. Distribution matters. Where the rash starts, how it spreads, and what other symptoms come with it are key clues. Example: measles. Starts at the hairline, moves down, typically sparing the palm and soles. Check for Koplik spots, tiny white blue spots of 1 to 2 mm size inside the mouth within 2 to 3 days of onset of symptoms. Chikungunya fever is associated too with severe joint pain. Thus, rash plus joint pain, classic combo. There will be too many things if we discuss all these here. But no worries, we will definitely do in disease-specific topics in upcoming videos. Don't you think your doctor needs to remember too many things for your single health conditions? Now, here's the most important part. When should you worry? Here are a few warning signs or red flags that mean you should see a doctor immediately. 1. High fever that doesn't come down with paracetamol. 2. Rash that is purple, bleeding looking, or doesn't fade when you press on it. 3. Stiff neck, confusion, extreme sleepiness, or difficulty waking up. 4. Seizures or fits. 5. Rash with shortness of breath or swelling of lips or face. 6. Child is not drinking or eating at all or has very low energy. How do doctors figure it out? A lot goes into diagnosing a fever with rash. It is important to know the immune status of the person, recent medications, long-term diseases or comorbidities, recent travel, exposure to domestic pets or other animals and bites, recent dietary change, recent exposure to ill individuals and sexual exposure, etc. Site of onset of rash, its specific features, its direction and rate of spread help in accurate diagnosis. Therefore, please do give all details of the course of your illness without hesitation. In fact, doctor may need some of your personal details to evaluate you better and provide you a right course of action. Doctors may do blood tests if they suspect dengue, liver issue, or other infections. In some cases, skin tests or allergy testing might be needed. If your child has a fever and rash but is otherwise active, drinking fluids, and seems okay, here are some basic care tips you can follow at home. Keep them comfortably cool but not cold. Offer plenty of fluids, water, breast milk, or soup. Give paracetamol for fever as per your doctor's advice. Keep their nails short if the rash is itchy. Dress them in light, soft, comfortable clothes. Please note, do not give aspirin to children with fever without doctor consultation, as it can cause a dangerous condition called Ray's syndrome. Do not self-medicate with antibiotics or steroids. These can mask the symptoms, and steroid can worsen viral infections, delaying the diagnosis. Do not scratch the rash. This may increase secondary bacterial infection or exposes other body parts to contagious fluid. Do not apply unknown cream. In conditions like dengue or heat rashes, excessive heat can worsen symptoms. So when should you visit a doctor? If the fever lasts more than 3 days, if the rash is spreading fast or looks unusual, if there are other symptoms like vomiting, breathing trouble, or swelling if the child looks very sick or lethargic. Can you prevent fever with rash? Not always, but here are some helpful tips. Keep up to date with vaccinations, measles, rubella, chickenpox, and more. Avoid sharing personal items during an infection, especially towels, clothes, or utensils when someone's sick. Wash hands frequently, especially after using the toilet and before eating. Avoid giving new medicines without checking with a doctor. To consider isolation if anyone in home is suffering from such a condition until you're confirmed if it's contagious or not. Boost immunity through balanced diet. Include antioxidants and protein. So here's your quick takeaway. Most cases of fever with rash are caused by viral infections and are mild. But you should watch for warning signs like bleeding rash, difficulty breathing, and drowsiness. Don't wait. See a doctor. If this video cleared up your rash confusion, hit that like button. Know someone who might find this helpful? Share it. And if you still have questions, don't be shy. Drop them in the comments below. I read every single one. Your question in the comment will give us an opportunity to make another useful video for you. Subscribe to DocDecoded for more easy-to-understand, reliable health videos. And remember, when in doubt, always check it out with your doctor.